So I'm excited to introduce our next speaker, Dr. Ivan Taniguchi. He's trained in both adult and child and adolescent psychiatry. He's been part of the University of Washington, Seattle Children's Hospital Psychiatry and Behavioral Medicine faculty since August 2022. Today, he'll be talking about a very pertinent topic, mental health and why it matters. Thank you.
Thank you for that really nice introduction. And yeah, my name is Evan. I'm a child and adolescent psychiatrist. I work with both kids and adults, and I'm going to be talking today a bit about anxiety in kids and teens. And uh, I'd like to share a screen. Mayor or Louise, could you enable that capability on my end?
Meher, I think you can make him a co-host.
Okay, let me see. There we go.
Great. Awesome. All right, so I'm going to try to pay attention to the chat, and if you have any questions, please feel free to say them out loud or unmute yourself, but I'll do my best to keep it on the chat as well. And Mary and Louise, let me know if you see anything that I'm not seeing pop up in there as well. But this is a topic that I think is becoming increasingly relevant to us today, especially in this kind of post-pandemic sort of era. And while I don't want to get into too much of the weeds of like maybe some of the clinical stuff that may be of more pertinence when you're actually on your clinical rotations, I think it's an important topic for us to all have kind of some basic understanding of. And hopefully in doing this talk, although it's not listed as one of our formal objectives here, I do hope to kind of spark an interest for anyone who does have an interest in mental health or anxiety, depression, and other mental health kind of related topics. So our goals for today, we're going to be reviewing normal versus pathologic anxiety in kids and teens, examining prevalence data just very briefly for anxiety in youth. We'll be describing how anxiety disorders can present differently in youth versus adults, and kind of outlining some basic strategies for managing anxiety in youth. And this can apply even if you just have a friend or family, I think, who maybe is trying to seek help for themselves. So defining anxiety. So anxiety is an emotional, cognitive, and physiological reaction to real or imagined threat that may occur now or in the future. And it's important to emphasize that anxiety is a normal feeling that everyone can have, right? All of us, to some degree, have some degree of anxiety. If I didn't have anxiety that maybe I lose my job, then I may not show up to work every day, in theory, right? So anxiety can be a helpful feeling that actually motivates us and informs us. It's not something that we necessarily always need to get rid of. And anxiety disorder is when we have an anxiety reaction that's so intense and persistent that it causes distress, and most importantly, starts to impair functioning. Maybe like a child stops going to school because of anxiety, or can't go out of the house, or can't go to family functions anymore due to anxiety. In children, this also must be developmentally inappropriate, and we'll talk about what anxieties might actually be pretty developmentally appropriate depending on the child's age. The problem is, again, when it stops us from doing the things that we need or want to do, or when we get so upset that we can't really handle our emotions in certain situations. And there's different theories about what causes anxiety, genetic factors, the whole nature versus nurture sort of theory. In the end, I think it's a combination of both, where there's some degree of kind of learning from your environment, past experiences, past trauma. And certainly, I think there's a genetic component or hereditary factor. There tends to be a high comorbidity, which means that basically there's a high degree of other kind of mental health disorders that kind of go along with anxiety. It's pretty rare for someone to just present with anxiety in my experience, especially in youth. The most common kind of comorbidity, so to speak, would be maybe depression. And symptoms, generally speaking, varies by age, of course, but there can be avoidance, which is a huge one. Avoidance basically of doing things that could provoke or cause anxiety, crying, freezing, clinging to adults, temper tantrums, acting out, or even somatic complaints, which is another way of saying kind of body or physical complaints, whether it be pain, or even some people will manifest their anxiety as things like non-epileptic seizures, if you've ever heard of that before. Looking at the data, there's generally speaking, a pretty high degree of anxiety in youth and teens. And this data, keep in mind, was way back in 2001 and 2004. This is like the newest NIH data that I could find, actually. But it reflects, I think, pretty well what we have today. At least a third or so of youth seem to be experiencing some degree of anxiety and may have risk of anxiety disorder. And generally speaking, those who are assigned female at birth may have a higher risk than those who are assigned male at birth. But I will say that anything that you see there in terms of like prevalence statistics, especially in psychiatry, I'll kind of ask students to kind of think about, are there kind of cultural biases there or socialization biases, and kind of like how even we as providers are kind of thinking and perceiving our patients, and like, are we more kind of just prone to diagnose anxiety in females versus male patients? Something to think about. And I'll just kind of comment briefly upon the impact of COVID-19 here. 37% of high school students in that COVID-19 area, kind of around that 2020 to 2021 sort of time period, experienced poor mental health. 55 experienced emotional abuse by a parent or other adult in the home. 11% experienced physical abuse. 29% reported a parent or other adult lost their job. So it was a pretty tough time. And I would say like a lot of kids haven't fully recovered from that time period, even though the healthcare emergency, as we all know, has ended, at least formally. That doesn't mean that I think the mental health of our youth population has necessarily recovered. I'm going to pause here and just see if there's any questions before I kind of move on. Okay. So, normal anxiety. So not all anxiety is, again, pathological. I think it's really important to emphasize that. And if you walk away with anything today, I would want to emphasize that if you have anxiety, that can be a normal reaction to the situation around you. It can be developmentally appropriate if you're certain ages. I'll go into some of these. So in late infancy, for example, around that 6 to 8 month age range, I don't know if any of you have kids, but it's pretty normal for them to start to have that stranger danger sort of anxiety. You're no longer kind of like this amorphous blob who feeds them and stuff. They start to recognize that people have different faces, and they start to recognize you as their parent. And they will start to recognize that, hey, like maybe this person is a stranger, and it's normal for them to start to cry if being left alone or if their mom leaves. There's even a whole kind of attachment experiment about that. So anxiety around that age around strangers, pretty normal. Toddlerhood, separation anxiety, being separated from your parent is pretty normal. Fears of thunder, lightning, fire, darkness, nightmares, all pretty evolutionarily programmed into all of us. Fear of even certain animals, including dogs and stuff, or barking and stuff. That's a pretty normal phenomenon to occur, right? Early childhood, fear of death, or dead people can be pretty common. There's a whole kind of theory around like how kids kind of conceptualize sort of death starting around this age and stuff, and kind of start to view death as kind of like this permanent, irreversible thing, and can be kind of scary. And then in the primary school, kind of elementary school age, fear of certain objects, or fear of like monsters in the closet or under your bed, or fear of germs, especially during this COVID era, fear of natural disasters or something really bad happening to you, like getting hit by a truck or something like that. That can also be pretty developmentally appropriate. And probably the one that we can most relate to, at least in terms of our ages, I suppose, is rejection from peers, something that doesn't always disappear after teenage years, right? But that fear of rejection and fear of being embarrassed or humiliated or something in front of the class, that's a pretty normal anxiety to have in this particular age group. So I see that there's a question. Is it you see direct connection between poverty and social inequality and anxiety among children and teens? So this is from Chanel. So I would say, in general, I would say lower socioeconomic status certainly, I think, has been associated with a variety of kind of mental health conditions. As far as like anxiety amongst children and teens, I would generally say that that tends to be true. I think that in general, I think a lot of that is tied to just kind of a lack of access to mental health resources and kind of appropriate treatments. And kind of going into that subject a little bit. So common disorders in childhood or adolescence. We're going to be talking about some of these disorders, not to review all of like the nitty gritty of the DSM criteria. But we're going to be going into a little bit about what different anxiety disorders can look like in certain age groups and how they might look different in a kid versus than in an adult. So separation anxiety disorder. This is a pretty child-specific anxiety disorder, right? It's not to say that some of us don't have worries about separating from our parents or going off to college, but generally speaking, most of us would not be diagnosed with a separation anxiety disorder as an 18, 24, or 30, 50-year-old, right? Normally occurs around 12 to 18 months. Again, that separation anxiety, this is not an anxiety disorder, keep in mind. This is just a developmentally appropriate separation anxiety that can occur around that age. Developmentally inappropriate anxiety related separation from a caretaker or attachment figure can occur kind of in the older ages. You generally start thinking about it more on like the school age sort of children. The first time like they're going off to school often tends to be kind of when you first start to see this, or maybe the first time they're going off to daycare. It can manifest as either anxiety itself, like crying or tantruming, or it can manifest as somatic symptoms, upset stomach, for example, or I have a headache, or I threw up today, I can't go to school, I have a fever, things like that, right? So you always look for those sort of things in kids where they're maybe manifesting in other ways besides just kind of the report of anxiety. A lot of this is linked to like maybe a fear of like something bad happening to that attachment figure. Maybe they lost a parent before, or maybe they're kind of afraid that their parent, something bad might happen to their parent, or maybe a fear that they'll be forever separated, or they're going to get lost, they're going to become homeless or something like that. All those fears can be pretty natural, but heightened to a certain degree where it starts to impair function again. That's why we call it an anxiety disorder. Loss of a caregiver or pet, family illness, traumatic event, these can all be kind of predisposing factors. Selective mutism is another kind of perhaps pretty common, and I would say not maybe as common as some of the other disorders, but pretty common in childhood, but not common in adults. It's beyond the normal shyness expected for age, refusal to speak in particular settings. I think I was trying to think of like kind of pop culture sort of examples of this, and this is kind of an old and sort of very historically inaccurate movie in general, but The Patriot with Mel Gibson. I think his daughter had a form of like selective mutism likely in that movie. She refused to like speak to others and like would only like kind of speak with her siblings, but even refused to speak to his character. There's generally speaking reduced academic performance, social isolation that can come along with it. Sometimes need to last for about a month, and it can't be the first month of school. And that's important to note because we have to give kids some time for adjustment, right? We can't just kind of assume that everything's just a disorder the first time that they go into school and that they're scared to speak in front of the class or scared to speak to their teacher. You want to rule out physical impairment, of course, or disability before the diagnosis. Of course, you want to rule out things like they can't hear or they have some sort of sensory disorder. It can often be comorbid with a social phobia, or in other words, social anxiety disorder. And here I will just say in general, this is one of those things that I think can often develop maybe because parents, very well-intentioned, may grow a habit of speaking for their child, right? And it might be like where it's like, well, then like, you should answer her or something like that. But then after a few seconds of awkwardness, most of us are going to answer for our child and stuff, right? If they're not speaking. But when that kind of pattern persists, it can lead to like maybe a pattern of the child just kind of learns inadvertently that, hey, I don't need to speak in certain environments, or I can kind of give into my anxiety and I don't need to talk in these sort of places and stuff if I don't want to, or if I feel scared. Any questions so far about these? Okay. So social anxiety disorder, very much related sort of disorder to selective mutism. Again, you want to rule out things like sensory deficits, autism spectrum disorder. Autism spectrum disorder usually more characterized by kind of less of a anxiety about social situations. Not saying that people with autism can't have anxiety actually about being in social situations, that can be common. But the primary driving factor might be less of like an anxiety and more of like a kind of either disinterest or kind of lack of awareness of like social norms or social conventions. May be expressed by crying, tantrums, freezing, shrinking from social situations. Oftentimes, social anxiety or avoidance can be transient, meaning that it's not always like a permanent thing that can occur. Sometimes kids kind of go through that quote unquote phase of like just kind of being anxious around other people, but as they kind of go through more and more social situations, they might get accustomed to it. And unlike adults, children may not have the option to avoid going to feared situations. Most of us who have characterized ourselves as introverts and we get invited to a big party, we can just say, I don't really want to go to that party. Whereas kids, for the most part, you don't really have an option most times to go or not go to certain social functions or family gatherings, etc. Usually social anxiety is kind of characterized specifically by like fears of like embarrassment, scrutiny, or judgment, or people looking at them. And again, can be quite limiting in the sense that it can limit you going to like certain social functions or situations. There's generalized anxiety disorder. In children, you generally speaking look for less criteria than you would in adults. And the symptoms that you're often kind of looking for are these kind of symptoms kind of outlined here, like excessive or anxiety, of course, but then there can be physical symptoms like fatigue, increased muscle soreness, impaired concentration, restlessness, difficulty sleeping. All these things can be kind of signs of like generalized anxiety. And this is when we kind of characterize the worries as, again, as the name might imply, general. It's not really specific to maybe any one specific phobia. And there might be specific concerns about maybe punctuality, catastrophic events, but it's all kind of generally mixed together. And they might be overly conforming, perfectionistic. They might be really unsure of themselves, ask for a lot of reassurance, maybe really overzealous and kind of seeking that approval from others. And in general, GAD, one of the most common disorders, typically also one of the more commonly misdiagnosed or overdiagnosed disorders. So you have to be careful of not overapplying this label and try to look for more specific types of anxiety. But again, something that a lot of kids end up being diagnosed with. Specific phobias. So kind of like in some ways the opposite of generalized anxiety disorder. This is when your anxiety is really just specific to one specific thing. There can be fear of animals or needles, and those two things are particularly common. And if you remember, those things can be developmentally appropriate. Oftentimes they're not permanent, they're transient. A diagnosis is often not warranted unless the fears lead to clinically significant impairment, like unwillingness to go to school or can't go to the doctor's office because they can't stand the idea of being near needles or getting shots, for example. Again, I'll emphasize that not everybody necessarily would constitute a disorder per se. And most of us tend to grow out of some of these things, right? Even without treatment. Things like needle phobias, for example. I was really scared of needles when I was younger. Like I used to need like multiple people to hold me down. And now I just need one person to hold me down when I get a shot. And next we have panic disorder. So panic disorder may have unexpected and repeated periods of intense fear, discomfort, along with other symptoms. Somatic concerns can be pretty common. And it's a pretty common reason for school refusal. Panic disorder often manifests as like these like really big intense periods of anxiety that kind of just spike, sometimes out of nowhere, sometimes caused by a really specific trigger. And generally speaking, it manifests not only as anxiety, but also as like oftentimes like these really physical bothersome symptoms like racing heartbeat or hyperventilating. There's even like this condition that can occur called cockropedal spasm, where like your hands or your limbs kind of start to cramp up because you're breathing too fast and it disturbs the calcium levels in your body, basically. it may be accompanied by agoraphobia, which, if any of you know, is probably most associated with like the fear of going outside. But I think that's actually often a misconception. Agoraphobia is more often characterized actually as the fear of like being in situations that you can't necessarily escape from. So it's not just the fear of going outside, it can even be the fear of like maybe taking public transportation. If that fear is like, I can't escape the situation, and then I fear that like someone's gonna like see me having a panic attack, for example. OCD, often characterized in the media a certain way, but I think also kind of misunderstood. It's not just like this like kind of overly cleanliness or uh, kind of fastidiousness and like washing your hands. It can also be things like checking or rechecking sort of obsessions or compulsions, even like self-harm or aggressive sort of obsessions or compulsions. There can be hoarding, there can be repeating or doing certain tasks in a specific order. Symptoms are classically in adults, at least, ego dystonic. And if you don't know what that term means, it's basically means that the symptoms are kind of disturbing to the individual themselves. Like they know that there's a problem with their behavior. But with kids, there may not be that kind of level of awareness. And uh, they may see their behavior as pretty normal or like be pretty upset when you confront them about it. There's gradual declines in schoolwork that can occur, secondary to impaired ability to concentrate. And has anybody ever heard of this condition called pandas before? Yeah, so pandas is a condition that can occur, uh, which basically has the characteristics of tics and OCD. And it's a very sudden onset of OCD or tics. And it typically occurs after streptococcus infection. I've maybe seen like 1 or 2 cases of this, but it's a pretty, again, pediatric specific sort of condition. It's pretty controversial still. It's one of those neuropsychiatric conditions that we're still studying. But it's a very interesting condition in that like that we have seen kids who have had this sudden kind of emergence of like obsessions or compulsions when they didn't have any before, or tics when they didn't have any before. And it's directly after a strep infection. We think that it's because basically of molecular mimicry and the antibodies that attack your streptococcus infection actually may inadvertently have some role in maybe attacking certain parts of your own brain or body that kind of lead to these symptoms. And the last disorder that I'll talk about here is PTSD. And some people wouldn't necessarily characterize this as an anxiety disorder per se, but I think it's important to talk about. A lot of kids will end up being diagnosed with PTSD, and it's really important to inquire about trauma, but do so in a very gentle and careful way. If you don't have the time to really go into detail, be sure not to ask for go into a lot of processing, I should say. Be sure not to go into too much detail, which can be re-traumatizing for some kids who aren't ready to talk about it. Don't ever force a kid to talk about it when they're not ready. And in general, in children, the criteria might be expressed by less classically the adult symptoms, maybe more just by disorganized or agitated behavior. There can be repetitive play that seems to reenact certain traumatic themes, like kids who like have really violent kind of play patterns, for example, or even maybe display like sexualized kind of play when like they really shouldn't know about that sort of behavior. There may be frightening dreams which occur without recognizable content, and trauma-specific reenactment can occur. So again, reenacting either with peers or parents, like trauma or abuse that's happened to them in the past. So what do kids have to worry about though, right? Like why are so many kids being diagnosed with anxiety disorders? I think it's important to keep in mind the culture that we're living in today. Social media, I think, has played a huge, huge role. And I'm one of those proponents for actually restricting social media in certain age groups. It's not to say that it doesn't play a role for some kids, especially when argument has been made for a certain minority groups or LGBTQ individuals that this actually can serve like as a support for teens where they may not have that support available in their own community. But I think on the whole, social media has played a really detrimental factor in kids' mental health. National politics, gun violence, you'd be surprised at how many kids come to me and report that, I'm really scared of going to school because like we have to do these mass shooter drills, and like I see the news and I'm scared of like something happening to my school. And it's really hard to counsel kids on that nowadays because it's not an unrealistic or unfounded fear that they have. Statistically speaking, it's still very rare, and we try to counsel kids on that and safety measures that are taking. But nonetheless, global events and crises, the war in Ukraine, the global uh, warming crisis that's occurring, increasing academic and economic competition, bullying, sexual assault, and domestic violence. All these things, unfortunately speaking, may be on the rise. And in general, I think our kids are going through, even though I think there might be some who talk about like our generation and how we didn't go through a whole lot. I think, kids nowadays are going through a whole lot that maybe previous generations didn't have to grapple with. So in terms of screening, the best screening, the tool that we have is called the SCARED, short for Screen for Child and Anxiety Related Disorders. There are some specific scales like the SciBox for OCD, CATS for PTSD, GAD-7 for GAD, preschool anxiety scale on young kids. In general, if you are one of those physicians on this meeting, it's good to have a screening tool available for reference, but you'll probably learn about this more as you go into medical school for the pre-meds on the call. And going into some treatment kind of advice, first of all, some common traps for parents, I think. Accommodation can often be a common trap. So rescuing or basically allowing your child to avoid like confronting their fears or confronting their anxiety can often be a common trap. It's a very common instinct that we all have to kind of protect our kids. And at the same time, we don't want to overprotect or provide too much of that reassurance, too much of that like, encouraging avoidance, like, oh yeah, you don't have to go to that party or something like that, or you don't have to go to school today if you don't feel like it, right? Because then what the child learns over time is that I can avoid the anxiety, and actually avoiding anxiety, we know over time, it might feel good in the moment, but it actually increases anxiety over time because we never learned to actually confront the fear or actually learn how to deal with the anxiety in the moment. First line treatment is usually therapy, of course. There are some pharmacologic options like SSRIs or SNRIs, which even in young kids may have some utility, but I don't generally tend to use medication a whole lot for kids. Generally speaking, the most common therapy that we use is this graded exposure to feared stimuli, right? All of us in our lives, I'm sure, have done some form of graded exposure. If any of you are pre-medical students, I mean, I remember when I was a pre-med that I used to have a huge fear of tests and failing my tests. I look back to my old Facebook posts and I talk about like my anxiety about test taking and all that stuff. And after about a bajillion tests going through medical school and step one and board exams and stuff, my anxiety is a lot less than it used to be. And that has just been through that graded exposure of like, well, you just keep doing it. And I used to be scared of public speaking, just doing it over and over and over again. That fear tends to decrease over time. Family coordination is key in a young age because most kids, if not all kids, are not going to be super motivated to do things that are going to make them feel uncomfortable or anxious. So involving the family is super, super important. And there is some evidence through this CAM study, a very landmark study that was done in kids and teens for anxiety, that show that maybe a combination of medication and therapy can be best for kids going through anxiety. But again, I don't tend to go to medications as a first line treatment for kids. Some strategies can help. Discuss your concerns, educate that many kids feel this way, correct distorted thoughts. If I don't get an A, then I'll die, or I'm never going to get into medical school, or if I don't do well on this medical school exam, then I'm never going to become the plastic surgeon that I want to be because no one's going to want to accept me and all that sort of stuff. It's all pretty common kind of catastrophizing fears, but again, try to correct those distorted thoughts, reduce stressors, offer relaxation techniques. If a parent is highly anxious too, it's really important that they be treated. And some last notes, remember to provide validation. Don't ever tell a kid, well, you shouldn't feel that way. You have nothing to be scared of. That can often be counterproductive, can make them feel worse. Encourage with confidence. There's a difference between reassuring, like, oh, everything's going to be okay, versus I believe you can do this and I believe you're going to get through this, right? You can encourage with confidence versus providing reassurance like, oh, everything's going to be fine, or like you have nothing to worry about, right? That's reassurance. Ask questions after facing fears to help their success sink in. So you always want to remind kids like, hey, was that as bad as you expected it to be? Or did that really bad outcome happen that you expected? And just try to remind them like, hey, like maybe that worst fear that your anxiety was telling you was going to happen didn't actually happen. Always reward brave behavior and try to manage your own distress, because again, as a therapist, as a psychiatrist, as a parent, it's really hard, I think, to see kids go through anxiety. But it's important to remember that you're not traumatizing your kid, whoever it is that you're working with, that you're not doing them a detrimental thing by asking them to challenge their fears. You're helping them over time, as long as you're doing it in a kind and gentle way. And tips for facing fears: expect anxiety, try to build up expectations over time, keep practicing, and just try to motivate as much as you can. Sorry for going over time there. And I see that there's a question. I'm just gonna try to stop sharing my screen if I can. Did I already stop sharing my screen?
No, it's still sharing. Well, I should first of all say I really love how you, Dr. Taniguchi, how you covered not only the phenomena, but also and the challenges that are facing young people in terms of mental health, but also the science behind it. So that was something that was really was really interesting to see.
Thank you.
Yeah, so I see we have a
Sorry for
question. Go ahead, Ajuni.
First of all, Dr. Taniguchi, thank you so much. This was an amazing talk and addressed like one of the biggest challenges that young people today face. I know you mentioned therapy as a resource that uh, teens and adults can use, but are there any local resources that teens can access in a time of crisis?
Yeah, actually there is. So there is a first of all, the 988 number in a time of crisis would be the line to access now that there's a national suicide hotline in a time where like suicidality or like the person is like an actual safety crisis. Uh, there's also the teen suicide hotline. And, to be honest with you, I forgot the exact number off the top of my head, what that text number is, but I give it out all the time to kids who are experiencing crisis, and the response is pretty immediate. I've actually just tested it out myself, to be honest, just kind of like, hey, I'm a provider, like, I just want to see how this works and stuff. So that's an excellent resource to use. I always encourage kids to like talk to their school counselor, who are often like great resources. Their therapist, if they have access to one, or the psychiatrist. I always try to make myself available for kids who are going through that like kind of crisis period. And I suppose lastly, like I think we usually counsel kids on even just identifying in their safety plan or in their crisis plan about, hey, who are like your trusted safe contacts and stuff, right? Because not all kids are going to want to use like a national hotline or just some kind of app that we can suggest to them. Some kids are like, well, I really trust my friend Jeremy or something like that, and I'll reach out to him if I'm in a crisis or something like that. And if that works for them, then in that moment, I think that's what they need to do, and that's great.
Thank you so much.
Yeah, thanks so much, Dr. Taniguchi. Thank you so much for your time today.
Thank you.